Apply QDA or tough skin on dorsal and plantar aspect of the ankle and foot. Next, apply heel and lace pads on the insertion of the Achilles tendon and anterior ankle to prevent rubbing. Encompass these with a layer of pre-wrap and then apply one layer of pre-wrap starting at the bottom of the gastroc, continuing to the base of the fifth, overlapping by half. Next, using 1.5 inch non-elastic tape, 2 anchors are applied at a slight angle around the distal lower leg, just inferior to the gastroc with moderate roll tension. And these are your proximal anchors. After these 2 anchors are applied, apply one more anchor around the midfoot, proximal to the fifth metatarsal, especially monitoring roll tension here. Since we are preventing an inversion sprain, we are starting our stirrups on the medial lower leg, crossing the medial malleolus across the plantar surface of the foot and over the lateral malleolus and anchoring on the lateral lower leg with moderate roll tension. Next, the first horseshoe strip is on the medial aspect of the midfoot and continued around the distal Achilles and around the distal lateral malleolus and finished on the lateral midfoot. The second stirrup is applied by overlapping the first by half in the medial to lateral direction. The second horseshoe begins on the medial forefoot and overlaps the first by half. The last stirrup begins on the medial lower leg and continues across the plantar aspect, overlapping the second by half. Close this out to make sure. Next, we will start the heel locks, starting on the medial ankle to the lateral malleolus at an angle towards the longitudinal arch, and this will be continued around the calcaneus and to the posterior heel, finishing where you started. 2 medial will be applied and 2 lateral heel locks will be applied. Once again, making sure for no wrinkles or gaps in your tape. After your heel locks are applied, you'll begin applying the figure 8 techniques, and 2 lateral figure 8 techniques and 2 medial figure 8 techniques will be applied. To close this taping procedure, begin distal to proximal closure, watching with moderate roll tension. Afterwards, check pulse motor sensory. For the loop arch technique, apply QDA or tough skin to the plantar aspect of the foot. Next, apply 1.5 inch non-elastic tape anchor over the base of the metatarsal heads. Beginning the first loop, use 1 inch non-elastic tape at the base of the fifth and proceed around the lateral heel with moderate roll tension and finish at the base of the fifth. Anchor the next loop strip at the base of the great toe and continue around the medial heel with moderate roll tension, and finish at the base of the great toe. You will repeat each loop 2 to 3 times, overlapping the first by half. The overlapping on the heel will be very minimal. After 2 to 3 strips are applied in each direction, apply a 1.5 inch anchor over the tape's ends on the plantar aspect of the foot. Next, use the low die technique to ensure complete closure over the plantar aspect of the foot in a circular motion. If ensured closure is needed, apply PowerFlex around the entire foot, watching roll tension. For the Achilles tendon taping, apply QDA or tough skin to the plantar aspect of the foot and the posterior lower leg. Next, apply a single layer of pre-wrap starting at the belly of the gastrocnemius and continuing distally all the way to the base of the metatarsal heads. For this procedure, the patient is prone Next, using 1.5 inch non-elastic tape, apply an anchor at the midfoot proximal to the 5th metatarsal head, and also apply 2 anchors around the belly of the gastrocnemius, making sure to watch roll tension. Using 3-inch heavyweight elastic tape, anchor the beginning of your strip at the midfoot and pull with tension and anchor at the belly of the gastrocnemius. For the next 2 strips, anchor at the midfoot. Instead of applying directly to the belly of the gastrocnemius as the first strip, rip each strip down the middle and with tension wrap the strips around the anterior side of the leg. For closure, once again watch roll tension with the 1.5 inch elastic tape around the gastrocnemius and continue distally and then place one more anchor For more closure, you can apply power flex with moderate tension to ensure no movement of the tape job. Once again, this is 2-inch lightweight elastic. Afterwards, check for patient function and pulse motor sensory. For the elbow compression wrap, use 4 or 6 inch by 5 yard elastic or ace wrap. Anchor the end of the wrap on the forearm directly to the skin and encircle the anchor one complete time. And using a spiral pattern in a distal to proximal direction, overlap each by half, making sure that all your roll tension is more distally and over the inflamed area. Finishing the wrap, you will close out with 1.5 inch non-elastic tape to ensure that the wrap does not move. For the finger buddy taping technique, you will be using 1/2 inch non-elastic tape and 1/8 inch foam or felt. Begin by placing the 1/8 inch felt in between the two fingers that are being taped. The first strip of 1/2 inch non-elastic tape will be anchored to the felt to ensure that the felt does not move during movement of the fingers. During this taping job, you will make sure not to cross the DIP or PIP of the phalanges. Make sure to watch roll tension when you're dealing with your phalanges. The second strip will be applied between the DIP and PIP. After, check pulse motor sensory and function. For the McConnell knee taping technique, apply QDA to anterior aspect of the knee. Next, using 2 or 3 inch adhesive gauze material, measure out enough to cover the knee. If this tape job is going to be used for a long amount of time, we recommend that the patient shave their leg. But if used for a short amount of time, a single layer of pre-wrap can be applied to prevent losing leg hair. Next, apply the adhesive gauze material directly over the patella. Next, using 1.5 inch rigid non-elastic tape, first we will demonstrate how to correct a positive glide component. You will begin by anchoring the first side of the strip on the lateral border of the patella, pulling the strip in a medial direction. Before anchoring the strip, you will approximate the skin and anchor the tape on the adhesive gauze material over the medial femoral condyle. To correct a positive rotation component, you will place a strip of rigid tape on the middle of the inferior pole of the patella, beginning at an angle, and pull the strip in an upwards angle medially and anchor on the medial aspect of the knee. This should cause the superior pole of the patella to rotate laterally. Lastly, to correct a positive tilt component, you will begin by anchoring a strip of the rigid tape on the middle of the patella, pulling the strip medially and once again approximating the skin toward the patella and anchoring on the medial femoral condyle. For the hip spiker wrap, use 4 or 6 inch by 10 yard elastic wrap. Begin on the distal thigh, encompassing your anchor one complete time, and continuing in a proximal direction up the thigh. At the proximal thigh, continue in this lateral to medial direction, across the lateral hip, around back of the patient, and back to the proximal thigh with moderate internal rotation or pull. Continue around the thigh one complete time. When your roll is completed, ensure closure with 1.5 inch non-elastic tape. For the toe collateral taping technique, you will apply QDA or Tuscan to the plantar aspect of the foot and use 1 inch or 1/2 inch non-elastic tape depending on the size of your patient's foot. Begin by applying one anchor around the great toe. Also apply an anchor around the midfoot using 1.5 inch lightweight elastic tape. Depending on the injury, to limit hyperextension, you will begin by placing one strip of 1/2 inch non-elastic tape to the plantar aspect of the great toe and continue in a medial direction overlapping the previous by half. After 3 to 4 strips of these are applied, close out this taping technique by applying one more anchor around the great toe and encompassing the midfoot anchor one last time with 1.5 inch lightweight elastic. For the thigh compression wrap, use 4 or 6 inch by 5 yard length elastic wrap. Begin by encompassing your anchor on the distal thigh one complete time and using a spiral technique continue in a proximal direction with more compression distally than proximally. After your roll is completed, You can have your patient assist you by holding the end of the roll and then using 1.5 inch non-elastic tape. Ensure that the elastic wrap will not move by applying 2 to 3 strips of 1.5 inch non-elastic tape. For the Wrist-X taping technique, apply QDA or tough skin to the dorsal side of the wrist and hand. Next, apply a single layer of pre-wrap around the dorsal wrist and hand. Next, we apply 2 anchors using 1.5 inch lightweight elastic tape. One around the distal wrist and the next around the hand. For this technique, we will limit wrist flexion. Apply the first strip of 1.5 inch non-elastic tape at an angle on the dorsal hand proximal to the second MCP joint, continuing across the hand and wrist with moderate roll tension and anchoring on the lateral distal forearm. Apply the next strip on the dorsal hand proximal to the fifth MCP joint, proceeding across the hand and wrist and finishing on the medial distal forearm. Overlap each of these crossing techniques to form an X technique by 1/2 inch, making sure to monitor roll tension. For closure, apply 1.5 inch non-elastic tape with moderate roll tension in a circular pattern. For the knee rotary taping technique, apply QDA or tough skin to the anterior side of the leg. Begin by applying single layer of pre-wrap, starting at the mid-thigh and finishing at the mid-gastrocnemius, overlapping each by half. Next, using 3 inch heavyweight elastic, measure the amount of tape you'll need to encompass the patella. Next, cut the 3 inch heavyweight elastic using taping scissors. Apply the heavyweight 3-inch elastic tape after tearing each end of the tape down the middle. Surround the posterior side of the knee with the side that is not ripped, and with tension apply the strips around the poles of the patella, superior and inferior poles of the patella. Next, using the 3-inch heavyweight elastic in a spiral pattern, anchor your first side on the midline of the leg and continue in a medial direction and anchoring on the middle of the thigh. Next, in another spiral pattern, anchor on the middle lower leg in a lateral direction, anchor on the middle of the thigh. For closure, use the 3-inch heavyweight elastic and close the ends of the tape used in the spiral direction. For AC joint tape, apply QDA or tough skin around the AC joint. Measure around 4 to 6 inches of 2 or 3-inch heavyweight elastic tape. Begin by anchoring the first tape strip on the posterior shoulder, stretching across the AC joint, and anchoring on the anterior shoulder, ensuring that the strip is completely down. Apply 2 or 3 additional strips, starting on the posterior shoulder and finishing on the anterior shoulder, to ensure enough support is supplied. For the thumb spica taping technique, apply QDA or tough skin to wrist and hand. Next, apply 1 to 3 layers of pre-wrap around the wrist, continuing around the thumb, returning to the wrist to lessen irritation between the thumb. Next, using 1-inch heavyweight elastic tape, anchor this strip to the medial dorsal surface of the wrist and continue in a medial to lateral direction around the wrist to the MCP joint of the thumb with moderate roll tension. Crossing the MCP joint and encircling the thumb, anchor on the dorsal surface of the wrist with moderate roll tension. The thumb should be slightly adducted and flexed. Apply 2 to 3 strips more of the 1-inch heavyweight elastic tape depending on comfort and support. For the elbow collateral taping technique, apply QDA or tough skin to the elbow and forearm. Next, apply pre-wrap starting at the belly of the bicep and continuing all the way to the middle of the forearm. Next, using 1.5 inch non-elastic tape, apply anchors around the belly of the bicep, watching roll tension. Next, apply anchors around the middle of the forearm, once again watching roll tension. Begin by placing your first anchor on the lateral side of the bicep, crossing the intercubital space of the elbow and placing your strip on the medial side of the forearm. Your second strip should start on the medial bicep, once again crossing the intercubital space of the elbow and being placed on the lateral side of the forearm. Continue to apply 3 to 4 strips of this technique. For closure, apply 1.5 inch non-elastic tape around anchors ends, once again watching roll tension, and check for pulse motor sensory and function.